Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us today. We're going to be speaking with Dr. Neal Kassell, founder and chairman of the Focused Ultrasound Foundation. He's joining us to talk about focused ultrasound. Welcome to Health Professional Radio, Dr. Neal Kassell.
Thank you, and it's a pleasure to join you this morning, Neil.
Founder and chairman of the Focused Ultrasound Foundation. Give us a little bit of your professional background, and then let's talk about your role there as chairman of the Focused Ultrasound Foundation.
Okay. In my prior life, I was the co-chairman of neurosurgery at the University of Virginia and got involved with this technology about 16 or 17 years ago and started the foundation 15 years ago to promote the adoption of this amazing new technology.
Are we talking about the same technology that says your baby is healthy or you've got a hernia? Is this the same type of technology that we're talking about?
Yes and no.
Okay.
So the yes part of it is it uses ultrasound, but everybody's familiar with diagnostic ultrasound, as you talked about. Focused ultrasound works in a different way. So imagine using a magnifying glass to focus beams of light on a point and burn a hole in a leaf. Okay. Where all those beams converge, it heats up the point and burns a hole in the leaf. With focused ultrasound, instead of an optical lens focusing beams of light, an acoustic lens is used to focus multiple beams of ultrasound energy. Mm-hmm. Where each of the individual beams goes through the tissue, it has no effect. But at that focal point where all the beams converge, just like where the beams of light converge, focused ultrasound can create what we now understand 25 ways that it affects tissue. So the beams are focused with a high degree of precision and accuracy on targets deep in the body, sparing the adjacent normal tissue.
That sounds extremely complicated to pinpoint a focused beam through tissue that you don't want to damage and not damaging that tissue. It sounds amazing to me.
It is amazing. And the point in the body where the beams are focused, the target, is selected and monitored and guided and controlled by real-time imaging, either magnetic resonance imaging or ultrasound imaging. So you can actually watch the effect that the ultrasound, the focused ultrasound, is having on the tissue in real time as the treatment is being administered, in contrast to radiation therapy, where the effects are invisible while radiation is being administered and where it takes weeks or months for radiation to have an effect. The effect of ultrasound is immediate and verifiable.
Now, mentioning radiation brings up images of cancer treatment with this type of technology. Are we talking cancer treatment in addition to many other treatments?
Well, let me give you perspective. So 10 years ago, there were 3 clinical indications, 3 medical disorders that were in various stages of research and development and commercialization around the world. Today, there are more than 130. So the field is growing rapidly. And it includes things like Alzheimer's and Parkinson's disease, and OCD and depression, and epilepsy and stroke, and benign and malignant tumors of just about every organ that you can think of, as well as arthritis and other conditions. So this is a revolutionary technology that has the potential to transform the treatment of a very wide variety of serious medical disorders.
You say a wide variety indeed. Alzheimer's, from Alzheimer's to cancer. Highlight a major example of this technology at work.
So let's take cancer of the breast, for instance. So focused ultrasound can be used to destroy the tissue, destroy the tumor, as an alternative to surgery or radiation to destroy it. Number one, it can be used to destroy the tissue. Number two, it can be used to deliver drugs in extremely high concentration precisely to the tumor and avoiding the systemic side effects. And number 3 is you can treat the tumor or a metastatic tumor and stimulate the body's immune response and enhance the effectiveness of the cancer immunotherapy drugs.
Now, using these focused beams of ultrasound, when you're talking about delivering drugs, are you delivering through some type of device that enters the body and then delivers ultrasound? Or are we talking about everything being done without any incisions or insertions at all?
Okay, so that's a very important point. Focused ultrasound is totally non-invasive, and it's incisionless. So it minimizes all the complications that you get with radiation or the complications you get with surgery, such as infections or hemorrhage. And, it's generally done on an outpatient basis, and recovery is very rapid, and the cost is less than the alternatives. So, but I have to emphasize that it's still in its early stages of evolution, and it'll take a while before focused ultrasound becomes mainstream, but eventually it will be mainstream, and it will impact the lives of millions of people around the world.
Now, is this something that can be used as a single therapy, or is it always in conjunction with some other type of therapy?
In most instances, it can be used on its own. Mm-hmm. In other instances, it can be used as a supplement or complement to other forms of therapy, whether it's surgery or radiation or drug delivery. So, but most of the time, it can be used on its own.
Often when we're talking about invasive surgeries, there are limitations. A person's comorbidities, weight, age, that sort of thing. When you're using this non-invasive technology to treat things like cancer or of the breast, as you say, or Alzheimer's, are there any restrictions as far as age or how healthy a patient is because this is non-invasive?
No, in a number of instances, it is a good alternative for things that are the current standard of care, like surgery, for patients where it's either contraindicated because of their general medical condition, the comorbidities you talked about, or patients who simply don't want the risk of surgery. Mm-hmm. So it's a good alternative in those instances.
Well, give us a website where we can learn more about your foundation and about this groundbreaking technology.
To learn more about Focused Ultrasound and the foundation, go to www.fusfoundation.org. www.fusfoundation.org.
Neal, I appreciate you joining us here on Health Professional Radio. Always great to talk to another Neal. Right.
Good. Well, listen, thank you. And if you need anything more, give us a call.
Will do, and I appreciate you. Thank you once again.
Okay.
I'm your host, Neal Howard, in conversation with Dr. Neal Kassell, founder and chairman of the Focused Ultrasound Foundation. Copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.